So the focus today is to try to get patients to have as much of their treatment, cure, recovery in their own country. It's a huge cost to the patient, it's a huge cost to the family, it's also a huge cost to the country. For people to go to another country to have their treatment, they have to travel there, that's expensive, they have to stay there, and of course they have to pay for the treatment, and then they're away from their family, away from their normal, comfortable surroundings. So the focus for MIOT is to give treatment within their own country. There's lots of treatment that already happens in Maldives. You have heart treatments, you have spine treatments, you have sports medicine treatments, you have joint replacement happening in Maldives. There's so much happening in Maldives. But what you don't have is rehabilitation. So even though you have so many specialists here, even though you have operating theaters here, even though you have so many surgeries happening here, there's no rehabilitation because there's no recognition that structured rehabilitation will give spectacular results. Why do patients not want to be treated in a particular place? They feel it's going to fail. Why do patients go outside? They think the result is going to be better. They think they'll get more satisfaction. What I want, they have got for me. What I wanted to happen, what I wanted to be able to do, what I wanted to be able to go back to, I'm able to achieve. You can get that in your own country with structured rehab. So that's the reason for having it. So a lot of Maldivian patients visit several countries for treatment, and you're absolutely right. A lot of them who are going overseas for treatment do come to MIOT. It's not only because Maldivian patients requested something that we do it. Because sometimes the patient may not know that it can be done in their own country, or the patient may request something that really can't be done in your country for some reason. Maybe it's a geographical reason, maybe it's an import reason, maybe it's a political reason. So when you want to do something in a different country, the most important thing is it should work, it should be successful, and it should build trust. Then you can do other things which are more difficult to do. Rehabilitation is a single thing that has completely changed the face of patient journey in MIOT for Indian patients. So Indian patients who think that everything is available in India, who have never gone outside India for anything, are flocking to MIOT Chennai because it's the only rehabilitation unit in the whole of South India, and it is packed, it is overflowing because the results are spectacular. It is simple to set up, it is easy to achieve, but it needs a collaborative structure to have a plan for each patient. It is not like going to a gym and saying, hey, my arm is weak, I'm going to exercise on this, or I want great biceps, I'm going to do this, or I want a six-pack, I'm going to do this. No. Based on what is wrong with you, based on what you want to achieve, a plan is made so that either you're doing it for 2 weeks, or either you're doing it for 6 weeks, or either doing it for 3 months. And that plan will get you to the target at the end of your journey. It has to be a plan. So there are various machines that are used, there are various specialists that come into play, there are various therapists that need to work on you. And it's very, very simple. It's very cost effective. It's within the patient's reach, and so we thought ideal for Maldives. Rehab in Maldives is being rolled out for a wide range of patients. So it could be something as complex as a patient who's had a bleed in their brain, what we call a stroke, and therefore has either weakness of both legs or weakness of one leg and one arm, or something very, very simple like a patient who's maybe got finger weakness alone, or a patient who's got a slight problem with speaking or memory loss, or a patient who has imbalance. By that I mean a human being who's elderly, for example, who's frequently falling, and you want to work on their balance. Could also be a patient who's a child who's walking incorrectly, and you want to correct that. And of course, other areas of the spectrum are involved as well. There's specific speech therapy, swallow therapy. So either you had surgery or you had some sort of cancer or nerve condition that makes swallowing difficult for you, or you're having a problem with speaking because there's an issue that has happened psychologically. Maybe there's a child who has some spectrum of autism. So all these things are also handled here in this rehab unit. So it's not purely physical rehab. So this particular scenario of how to do a treatment plan is something that we've been doing day in and day out now for the last 3 years back home. You have a specialist who has to coordinate the treatment, and this is a specialist who has a degree in rehab. It's very difficult to get such specialists locally in Maldives. We have a lot of them back home. Either that specialist will be sitting here in Maldives to do it face to face, or the specialist will be sitting in Chennai and the patient looks via the telemedicine suite to get a plan. So the first we examine what is wrong with the patient. The patient tells the specialist either they've been having a particular problem, or they have a known disease, or they've had a recent surgery or an accident. And then we look at what all they want to do and what is it that they can't do now. And then a program in collaboration with others is written down for the patient so that the patient has an idea how many hours a day they're going to come, how many days a week they're going to come, and how many weeks or months it'll take to achieve that target, which equipment has to be used, and which local allied health person will be administering to the patient is also written down. And then the payment is attached to it. If the patient is linked to Asanda, then Asanda will reimburse or Asanda will pay, and then it starts off. Of course, yeah, the prices have already been shared and approved by Asanda, so we're good to go. So this is a scenario that has been played out many times and that we've addressed many times over the last years. We have patients coming to us from 130 countries and who don't know sometimes what disease they have and who send us reports. And in such cases, we organize telemedicine for the patient with a particular specialist or with 2 or 3 specialists, and we get a working diagnosis. Then we sit and do a collaborative meeting, what we call a rehab board meeting, and then we come up with a program for the patient, which the patient can follow here in Maldives. I think it's been a great partnership with Maldives. We are impressed with how well oiled the machinery in terms of bureaucracy is. Permissions have been easy to get. There's a lot of transparency in the government. And also the work ethic, the work culture in Maldives has impressed us. People work very, very hard here. The medical community works extremely hard here. And this is something where we have synergy with back home in India. A lot of Maldivians in the medical community, nurses, technical staff, doctors have often come to Chennai, to MIOT, to acquire certain particular experiences or skills. We've had shared training programs in various areas. Also in administrative areas, we've collaborated with some training programs. And we're very excited for Maldives. Our goal is to try as far as possible to ensure that fewer and fewer Maldivians have to leave Maldives for treatment. That's our ultimate goal. Absolutely. You see, expansion happens with trust. So once we are able to run this very, very well, once we find that people realize that we're not here for a quick buck, that we're here for a meaningful reason to actually make a difference, then definitely this is a small seed that will grow into a big tree. Well, I think this is something that applies universally, whether the person is treated in Maldives or the person is treated overseas. Once the surgery or that one sort of scenario which is supposed to change the course or direction of the patient is done, the aftercare is hugely important. Without that aftercare, you don't actually reach total cure. And that is the reason why you need such units in the Maldives, to make sure that patients whose lives have been saved also get back their quality of life. Well, we hope that we will be able to improve a lot of people's outcomes. I mean, people are having sophisticated surgery here in Maldives. People who are young, who play sports or are active, are having treatments. People who have been bedridden or people who are having difficulty because they have nerve problems are having very good spinal surgery and spinal treatments here. But a lot of them have not reached the destination or the result that they want to achieve. And this unit will achieve that for them. And this unit will also encourage other Maldivians who have the skill in rehab to work here in this unit and to set up their own units. Well, I think they should keep going. The medical community here is hardworking. They're very, very on the ball. They've been adopting new technology. I am just so proud that they are doing such great work and keeping the name of the medical profession as high as it can be. And they should not be disheartened, should not lose heart. And all of us in the medical community, both in Maldives and the rest of the world, should realize that the most important thing is the patient. You have a happy patient, you have a satisfied patient, and that is the reason why a lot of us have entered this profession. The concept of rehabilitation has been confined in developing countries to mere physiotherapy. They have not adopted a holistic approach. Rehabilitation is not mere physiotherapist following the instructions of the treating doctor and ending with that. Rehabilitation is to assess a patient or assess a child or an adult who has a disease or some condition and say, what is it that you want to be able to do? What is it that you want in terms of the label recovery and achieving that? That's rehabilitation. And that doesn't just involve a physiotherapist. It doesn't involve exercises. It involves a program to get you there, a collaborative program. And I have seen with my own eyes thousands of times how such a program, which is not even very expensive, which is so reasonable, affordable in a poor country like India, has spectacular results. That belief, once we give Maldives, you'll get, I don't know how many more rehabilitation units. But that's something that you will see